Hi, my name is Dr. Sion Katuma, and I am a board-certified obstetrician and gynecologist, daughter, sister, child of an immigrant, and patient advocate. We have explored the multitude of issues that are essential to advancing Black maternal health, from building more culturally responsive care solutions to destigmatizing maternal mental health conditions. We all have a role to play in this movement. When we do advocacy work, it's important to tailor the messages that we tell to the specific audiences that we are trying to reach. First things first, we need to decide who we are trying to reach with our message. Figuring out who you are trying to reach starts with understanding what kind of change you are trying to affect. It can help to make a list of the key stakeholders who are involved in the issue that you're working on. If you're focused on improving the birthing experience of one individual, you may interface with their doctors, family members, and friends. If you want to change a workplace policy, you may need to talk to the HR department or a senior executive. Maybe you want to make a general message to community members to raise awareness about a specific issue. Each of these audiences is going to resonate with a different argument, and you're going to need to tailor your message to appeal to their conscience. Think about what is your audience's motivation and how you can come together for this shared goal. When it comes to community members, it may make sense to speak more colloquially and really focus on the stories and the people behind the change you are trying to make. For employers, you need to make them understand why these changes are beneficial to their employees and also their company as a whole. You need to tailor your argument to align with their interests as well as yours. It's strategic to take a multi-tiered approach that has different messaging to each of the key stakeholders in the change that you are trying to affect. Now let's talk about your ask. Even though every stakeholder needs a specific kind of message, there's some strategies that really make sure that your messaging is hitting home. When it comes to talking to stakeholders, you need to communicate clearly and get to the point right away. What is the issue at hand, and why should people care? Now is a good time to bring in important research and statistics that strengthen your point and speak to the gravity of the situation. Once you have delivered the facts, it's time to go a little deeper. What motivated you to get involved in this movement, and why are you qualified to speak on the issues? This is the time to share your story and help the audience understand why you are the person who they should be listening to. Maybe you work in maternal health, your partner had a poor birthing experience, or you are an invested community member who wants to build a better world. When you share your why, people become more invested in your story and what you are saying. Now that they understand the issue and your stake, it's time to make the ask. This is a crucial step. What is the action step that your audience will take to move the needle forward? Whatever the ask is, make sure it is clearly outlined and your audience understands exactly what they are supposed to do. We started this session exploring the state of the Black maternal health crisis and what it means to be an advocate. We then went one step further to explore specific issues in maternal health that needed to be addressed and the different ways that stakeholders can get involved in this movement. Finally, we ended this session by teaching you how to translate your message into direct action from your target audience. We now encourage you to get to work and start engaging with these issues on a daily basis. You can start small. What is one action that you can take today to advance Black maternal health?